Hi, everybody. I'm Chris Hayes from Hayes Physical Therapy, and we're going to get started in a few minutes. And if you're just joining us, please go into, there's a little black box up there, question and answer. If you'll just put your name in there so I know who's present today for this workshop. And then also you can share what's going on with you. If you've had any problems with your back and what activities tend to irritate it the most. Okay, and we'll be starting in just a couple minutes. Good afternoon, everybody. This is Chris Hayes from Hayes Physical Therapy, and we will be starting our back pain and sciatica workshop in just a few minutes. Hi, everybody. This is Chris Hayes from Hayes Physical Therapy. And as you're joining us, I want to say hi, shout out to Kathy, Michelle, Jen, Parita. And we're going to be getting a couple more participants in on this particular workshop today. But while you guys are there, if you would do me a favor, and you should see a little question and answer Q&A box. If you guys can just put your name in there and let me know a little bit about what's going on for you with your back. Is it something that you're having pain in the back? Is it going down one leg, both legs? And what kind of activities make that worse? So just put some of that information in the Q&A so I can be sure to customize this for you. And we'll also get to all those questions and answers at the very end. And we'll get started in just about 2 minutes. Deshant, welcome. So everybody, we're just getting some information from you guys before we get started. Jen, thank you for that information. If you guys, there's a little question and answer box that you're going to find. It's either at the bottom of the slide presentation or at the top. If you hover over that, you'll see a Q&A section, and just go ahead and write some information in that Q&A box so I can customize this specifically for you guys, and we'll be sure to get to those questions and answers. You might want to say something like, my name's Chris and I'm having back pain that goes down my left leg. It's worse with sitting and driving. Something like that, and that way it gives me a little understanding of what's giving you the greatest amount of discomfort. So for all you guys that are currently having discomfort or who have had discomfort in the past, just go ahead and put some of that information in the Q&A. Thank you, Jen. I saw your comments in there, and we're going to be starting in a couple minutes. You guys are shy. I don't see too many questions in the question and answer area here. Thank you for joining us, Shira. Let me know if you have anything that's coming up for you with your back, and be sure to get to that in just a minute, and then we're going to get started. Hi, Barb. Nice to see you. So in the questions and answers, in that Q&A box, just put down anything that is bothering you with your back, that you're either currently having problems with. Tell me where the pain's located and what things make it feel the absolute worst. And then we're going to get rocking and rolling in just a minute. Okay, good. Thank you. I'm seeing some other things in here. So Karen, your pain is worse if you stand and walk too much. So I'm just taking a couple little notes here right before we get started, standing and walking. I have an anonymous attendee that says pain on either side of my back from a fall a little bit ago and a stomach sleeper. So I'm just going to put that down as an anonymous comment, but a fall, so we have a trauma. And that you're also a stomach sleeper. We'll talk about that too. All right. Let's see if we have anybody else joining in. So we're going to start now. So if you're just joining us, hi, my name is Chris Hayes, and I am with Hayes Physical Therapy. I am the practice owner of Hayes Physical Therapy, and I'm happy to see you all today. And I want to keep this as interactive as we possibly can in this virtual world. So if you guys have specific questions and answers, you're going to see a Q&A box that you can hover over, and you can just write in what activities seem to give you discomfort and where that discomfort is. So I'm just seeing a couple more here, and I'm just going to write a couple notes to myself, and then we're going to talk about all of this. Okay, gotcha. Thank you for that comment, Deshant. So sitting, mid to lower back for prolonged sitting. Okay. All right. Okay. So So again, you are here probably because you've had some kind of a back issue presently or in the past that has been difficult for you. And back pain is no fun. It can really change everything that we do, right? It's such a focal point for all activities. So today's workshop is on low back pain and sciatica. And in Hayes Physical Therapy, our goal is to help people with pain get back to normal without unnecessary medications, injections, or surgery. So those things are kind of a last resort for us. And so we're here to try to give you some ideas of how to do this kind of stuff all naturally. Okay, so again, my name is Chris Hayes. I've been a therapist for over 33 years, a physical therapist, and I started Hayes Physical Therapy in Paoli about 21 years ago. I have a staff of 5 clinicians. 3 are physical therapists. They have their doctorates in physical therapy. They're excellent. And 2 are physical therapy assistants. And not only do we treat orthopedic conditions and sports medicine, but we also have several specialty niches where we have a golf fitness and rehabilitation program. We also have a specialty niche with osteoporosis and osteopenia. We do functional movement assessments to look at the total body and see where people that are exercising or the regular workforce are going off the rails in certain movement patterns. And we also work with cancer patients, doing cancer-related fatigue issues, lymphedema, and a lot of post-op work. So we do many things, and we're happy to be of service to all of you. So I think most of you have seen, I asked you in the question and answers, and you can do it now or throughout the presentation, just putting in the question and answer what your name is, and also, what's going on for you right now? Okay. So what is the sciatic nerve? The sciatic nerve is the longest nerve in the body. It's actually also the thickest nerve in the body. It is very, very thick. It's almost like an HDMI cable, very, very thick. And the sciatic nerve is actually made of 2 nerves. And those nerves split and divide by the time they get down around the outside of your knee. They split and divide. That's why some of you might have pain if you've had sciatica that goes to the big toe in the front of the shin to the big toe, while others might be on the outside. It's that location where that nerve splits. And by the way, Lisa from my office, unless you were really late in registration, she should have sent to you a little worksheet that says sciatica and lower back pain. It's a worksheet for simple steps to natural healing, and you'll see that there. And if you're someone who likes to take notes, you can take notes. The slide deck corresponds with some of the things on that worksheet as we go, or you can just tune in, relax, and enjoy. So just wanted to let you know you should have received that as well. And then the next piece about the sciatic nerve is it travels down the leg into the foot, and when it's pinched, it can cause pain, tingling, and weakness in the leg, and sometimes even heaviness. So how did we come to specialize in back pain? Well, I'm going to tell you a couple things. First of all, for myself personally, when I was 13 years old, I suffered 2 herniated discs in my low back. So just to set the stage, 13-year-old girls usually have pretty poor posture and a lot of roundedness. And it happened that my little Irish grandmother was staying with us, and she was under 5 foot tall. And I was watching her for a couple hours, and she fell from her chair onto the floor. And even though she was under 5 foot, she was very stocky. And so 13-year-old girl with poor posture steps into the picture and tries to help my grandmother up off the floor. I was hoping she was going to help me, but she didn't. So she became complete dead weight. And as soon as I was able to get her up and push her back into the chair, I felt a searing pain shoot out through my right side of my low back, down through the buttocks, down through the leg, all the way out the big toe. And not only was it very, very painful, I couldn't stand back up. I was stuck in this position like the Hunchback of Notre Dame, and I couldn't get myself back up to a straight alignment. And of course, my Irish grandmother was very funny. And she said, we can't tell Peggy what happened. We can't. Peg was my mom. So a couple days go by. I am still in a lot of pain. My Nana's still staying with us. And my mom, wants to know what happened. Why can't I straighten up? And I tell her the story. So at any rate, the funny part of this story is my mom finally asked my grandmother, yeah, do you know what happened to Chris's back? She doesn't seem like she can stand up. And my little leprechaun fabricated a very great little story. And she said, oh, that Chrissy, always trying to help someone. She helped a little old man out by the curb. I bet you that's how it happened. So the story was exactly true, except that she was the person, not the little old man out by the curb. But at any rate, taking an injury like that when you're 13 years of age is pretty serious. And, it certainly has led to why I really am passionate about back pain and getting people better all naturally. And a side note with that is a lot of people are going to try to offer you exercises, how you should do it, what was the best solution, to make their back pain better. And don't take their advice. See somebody who really knows what they're doing comprehensively. Because even at that young age, 13 years of age, I was given all the wrong exercises. So it just made the problem worse and worse and worse until I finally got to the right person who knew how to handle herniated disc in the back. And I've stayed active, healthy, no injections, no surgery ever since. So that's my personal story, why I really enjoy working with back patients and helping you guys out. The second thing, which I spoke of earlier, is that we also work with osteoporosis and osteopenia. This population is also near and dear to our hearts. And Dr. Stephanie Bean, one of my physical therapists, she's got certifications in this realm, and she works with people to prevent stress fractures and to get them on good exercise programs. And then sometimes we see people after stress fracture has already taken place, and we can really be helpful in guiding you how to feel better and then how to go forward. She's also collaborated with our physical therapy assistant, Josette Ciccacci, who is a yoga instructor. And both Stephanie and Josette also offer a yoga-based safe exercise program for people with osteopenia and osteoporosis. And you'll be probably, not surprised to hear this, but a lot of the elderly population, when they're given yoga programs, a lot of it is chair yoga. And that's the worst possible thing that they could possibly do, because that's the most loaded spine position. And, so we've really taken a lot of time to pick the exact right exercises that incorporate safe yoga postures for bone density, and then also to work on balance as well. So that's another little side note. And then lastly, we work with a lot of orthopedic surgeons, neurosurgeons, the PM&R physicians, which are typically the ones that do pain management for injections and so on and so forth. So we see anything from, back strains to herniated discs, to spinal stenosis, to pelvic and sacroiliac pain. Also, we see surgery, so we might see microdiscectomies, laminectomies, fusions. So we really specialize and do it all, and we're happy to help. So I didn't notice that did anybody in the group, I just want to kind of call back to the group for a moment. Did anybody in the group put in the question and answer if you've had surgery? I'm really curious about that, if anybody's had surgery. And I'm just kind of scanning through that, but if you've had surgery, give me a shout out and let me know what you've had too. Okay. All right. Got it. I've seen some of your other questions in there. So yeah, that's an important piece as well. So as we continue here, what's the biggest mistake that back pain and sciatic sufferers make? You guys probably know it. Do nothing, right? Do nothing at all. So back pain and sciatica rule. The longer you've had the pain, the longer it takes to get relief. So, it's funny because, we'll interview people, and when we're taking their history and we'll say, how long have you been suffering with this? And they might say, they're suffering with it for a year or 5 years or 10 years. And we get some really complex cases, and that doesn't scare us because we really know how to differentiate and tease out all these complexities. But, the longer you have it and you don't do anything about it, you're just delaying that healing. And sometimes it can take twice as long to feel better. So the interesting thing is those same people that wait that long also want to be better yesterday. So don't wait, don't delay. Right. So let's look at your worksheets. So if you have the worksheet, you can take a peek at this. So I want to know if, when we see you in the office, is your pain reproducible? That's the most important thing a physical therapist wants to know. And we actually want to reproduce that pain, even though it might, feel like, oh my gosh, they're killing me. If we can reproduce it, we're happy. Not because we're hurting you, but because then we know that if we can reproduce it, then it's also reducible. And that's a really big win. So I want to know what day-to-day activities make your pain worse. So I know that some of you have said walking and sitting, lifting, bending, changing positions. I'm going to read from the list. Karen, standing and walking is painful. Shira, sitting for prolonged periods is painful. The same with Duchamp. And Jennifer, a little bit more with activities like landscaping, right? A lot of bending, golf, twisting. So, and then some of you have said you've had a traumatic fall. So just sort of circle to yourself, what are the activities that make you feel the absolute worst? And just kind of take notice to that. And there are 3 ways to handle pain. So we already alluded to this earlier. The first is to ignore it. And that sounds like a lot of excuses, right? It sounds like, the pain only bothers me with running. And then I say to that person, well, what do you do? Well, now I'm not running. And that person's totally depressed, right? Because they're now changing quality of life and they can't run anymore. And sometimes they don't come to see us right away. So by the time they come to see us, they say, well, it started, as a running problem, but now it even hurts with walking. And now I'm, scheduled to, maybe get some injections and so on and so forth. Or you might say, I don't have the time, or it's too far for me to go, or I don't have the ability to, carve that time out in my lifestyle. It sounds like a lot of excuses, right? And we all make them. I get it. But that's not the way to handle pain. The longer you wait, some people will say, oh, well, it's just arthritis and it's something I have to live with. It's my cross to bear. My whole family has the same condition, so that just sounds like more ways to just not, handle the problem. The second way is also to alter it. So again, going to that one person, and I think, Mary, you also said that running is something that you love to do and you're not able to do that anymore. So either A, you stop doing those activities, or you play through, or you work through those things and you start to shift and change the way your body is moving. So not only is this a local problem, right? It becomes a regional compensation, and it can actually become a total body compensation that is really off kilter because you just are trying to change it on your own, and that's really not the right way to go, right? So altering it is not the answer. The last answer is really what you should be doing. It's handling it, and handling it with a team that is so skilled that they can pull out these little pieces to find out what is exactly going on. Is it a local problem? So if we're talking about low back pain, is it a muscle thing? Is it a disc? Is it stenosis or arthritis in there? Is it the sacroiliac joint? Is it the hip? What are all the little complexities that are happening in that area? And, maybe it's not even coming from there at all, and we're especially trained to be able to tease that information out. So there are 3 common causes of low back pain and sciatica. And the very first one is a herniated disc. I didn't see anybody on the list tell me that they've had a herniated disc. If you did, then what we're looking at here is looking at the spine. So when we look at the area up here that is the bony area, that's the vertebral body. And by the way, this is where you see a little crack in there. That's somebody who actually has a little osteoporosis and a little compression fracture through that vertebral body, because that's actually where fractures occur, is in the body here. When we look at the blue area, that is the shock absorber. That's the disc material that if we go over to the slide over here to the far left, that disc material, there's a wall, this thick wall that has these little lines in it. That is called the annular wall of the disc. It's very thick, and you have an outside wall and you have an inside wall. And in the very middle is this jelly-like watery substance that's for shock absorption. Just think if you were kind of like bouncing up and down, that disc material absorbs all those forces. And in a healthy situation, all of that stays contained. But here in this situation, you can see where a piece of this material is pushing through and tearing through that outside wall and actually hitting on the nerve. And there you can see right there hitting on that nerve. It's red, hot, it's irritable. And in that particular case, that person's also going to have pain that's going down the leg as well. So herniated discs are really, really painful, and it's something that we work with all the time. I'm just going to scan back and see if anybody has told me here that they've had herniated disc material. And interesting, there's somebody anonymous here that says they've had a terrible pain. It started in their left hip and shot down the leg in the form of a Charlie horse, continued all week. Now, something that starts to shoot down the leg is certainly not bursitis, and it's not usually an IT band. When it starts to go all the way down and it gives you that Charlie horse, it's the nerve that's being compressed. So I'm not sure who that anonymous attendee is here, but yeah, that would likely be something is compressing on that nerve, and we're not sure what exactly that is just yet until we do our examination. It could be the disc material, or it could be a little stenosis. So that's important information. So herniated disc, that's something that we commonly see in the practice. And when we go to the next slide, you're going to see a little bit more about that sciatica that's caused from herniated disc. So there you see, again, that little disc material coming out, and then it's also typically affecting going down the leg. And as physical therapists, we know exactly which disc is herniated by where you tell us the symptoms are, even without an MRI. And quite honestly, even if a patient comes in with an MRI, I don't even look at it till the very end, because I want to be able to ascertain for myself where exactly they're having problems. And I also don't want to bias myself to think that the pain is only coming from, a disc. It might also be coming from a couple other complexities at the same time. So this is an example, and we know exactly through the movement planes that we put you in, how bad the disc is, where exactly it's positioned, where exactly what nerve root is it involving. So herniated disc symptoms usually increase pain with forward bending, twisting. So when I picked up my little Irish grandmother, I had the combination of poor posture in a forward bend position, and I was twisted a little bit to get her up. It was the perfect storm to blow out 2 discs. But you can also get this kind of herniation from coughing and sneezing, especially if you're somebody that has a really big, forward thrust when they cough or sneeze. That can be enough force to push something out, especially if they're already predisposed and their posture over time, they're kind of getting rounded and rounded and rounded. And now you see it's very easy for that disc to shoot out the back with something really, really easy. Sciatica pain is usually very sharp, and it runs down the back of the leg. And typically it's just down one leg when you herniate the disc. Now, I've had patients that, one day they're having the pain, the majority started on the right side, and then it's going down the left. Discs can be like that. Sometimes, in the healing of those discs, sometimes, overcorrection can cause it to go down the other side. They can flip-flop a little bit. So that can also be typical of a herniated disc. And our goal with herniated disc patients is the further that pain is going down the leg, our goal is to get it to come back up out of the leg and get to the source at the top. Even if it becomes more painful at the top, If it starts to go out of the leg, that's actually a green light. We're moving in the right direction. And then the next step is to quiet it down from the back. If the pain with whatever we're doing, movement, life, exercise, is going further down the leg, that's called peripheralizing, meaning going away from the source. That's a red light. That's not desired. We want to try to pull it back up, get rid of it out of the leg, and then reduce it from the back. So herniated disc patients usually are under 40 years of age or younger, but that's not a steadfast rule. I've treated patients in their 50s and 60s and even early 70s that have had herniated disc, but typically it's the younger population that has a herniated disc. And so we see that all the time. Another cause of low back pain and sciatica is arthritis or stenosis, or also DDD, degenerative disc disease. So if we look at this little spine model, and I want to call out, so Karen, I think you said that standing and walking was problematic, and there was a couple other patients there. So, you know, just tune into this. This is really important for those of you that have pain in standing and walking, and then when you sit, it's better. You know, you're probably more in this arthritis or stenosis grouping here. So we talked about that blue disc material there. And as we get older, we lose some of the hydration in this area. So the distance between the bones actually compresses down a little bit. And so in that compression, things get a lot tighter here in the back where your spinal cord is and where your facet joints are. So the facet joints are in the very back, and you have facet joints at every single level. And when you bend forward, those facet joints open in the back, which gives a little bit of relief, which is why you feel better when you sit, because typically you open up the spine a little bit. When you're standing, or if you stand and bend backwards, those facet joints close down. And so you might get some pinching there. So the type of patient that, you know, we often see with this, you've seen them, you know, they're shopping in the Acme and they're hanging over their shopping cart and they're walking around. And why are they doing that? They're doing it because that feels better. But is that a healthy fix to that problem? And I'd like to tell you that no, that's not a healthy fix to that problem. And there are certain things that we can do to also create that opening and get you looking straighter. So another interesting thing that I want to just say is, if any of you are saying, Dan, like you said, you know, sometimes you have some disc issues with work-related activities, and you're in that category where you're like 60, so, you know, you're wondering if it's arthritis versus herniated disc. Sometimes we see people that have two conditions going on at once. They have a little bit of stenosis happening, and they also have some disc stuff. So it's interesting because the treatments are completely different. And that's why it's important not to take advice from anybody until they've comprehensively evaluated you and can tell you the right thing to do, because it can actually make it much, much worse. So that's one of the things, Dan, that I'd say, you know, come on in at the end of this presentation and get a complimentary screen and let's tease it out for you. Because when people say stenosis, the definition of stenosis means that there's a narrowing in the canal where the nerve exits. It doesn't tell you who's at fault for the stenosis. So if we see an MRI finding, and maybe it's somebody who's, you know, 50 years old, or, you know, and maybe they be in this stenosis or over 50, you know, when we test them, we actually can tell, is it the disc that's occupying that space causing that narrowing, which makes the, you know, diagnosis of stenosis, or is it really arthritis, bone on bone? So that is really, really important to be able to differentiate, and that's what we do. So arthritis or stenosis symptoms, patients have standing and walking pain. That, Karen, you mentioned that. Relief with sitting, and it typically affects people 50 years of age or older, and it can go down one or both legs. So there's the sciatic nerve pathways, one or both legs. I want to check back in with you guys here before we go any further and see if anybody else has said anything. Yeah, so I see you, Karen, standing and walking. We already talked to Jen. We're going to look at yours a little bit later. We have somebody, an anonymous attendee who took a fall. Sitting is sometimes painful, so sitting We're going to talk, Shira, whether sitting could be more herniated disc or bulging disc, which is not as severe as a herniation, but it could progress to that, versus sacroiliac joint, which we're going to talk about in a minute. And we're just taking a peek at a couple other pieces here. Again, the person who had that terrible pain that was a Charlie horse from the left hip area and down, I'd be suspect about the nerve. And someone else, thank you. I see that you had surgery. There we go. So there's one person for surgery there. And I'm not sure when you mention the type of surgery, the core surgery, if that was a surgery to tighten up the stomach area, like an abdominoplasty, or if that was actually for a disc. I see that you say your disc is herniated, though not severe, and you're trying to do some core strengthening to stay in shape. Okay, stay tuned with that, Bert. Okay, Karen, good point. How do you know it's not piriformis syndrome? We're going to get to that in a minute. And Barb, I see you there with left back and sciatica. Pain is with walking or sitting too long, so prolonged positioning, postural. Okay, gotcha. Thanks, guys. You're doing great participating here. Now, the third cause of low back pain and sciatica. So number one, to review, herniated disc, okay? 40 years of age or younger, bending, lifting, that kind of thing. Number two, arthritis or stenosis, usually 50 years of age or older, and that's the shopping cart posture, folks, and standing or walking is worse, sitting is better. Now we come to the third common cause is sacroiliac joint, SI joint pain or pelvic pain. So this is the low back, L3, L4, and L5. These are movable areas. And then we get to the fused part of your lowest part of your spine, which is your sacrum. And down here, that little triangle is your coccyx bone. And then the pelvis here, also called your ilia, where the pelvis meets the sacrum, is the sacroiliac joint. So sacro is sacrum, ilia, pelvis, and this red line here is a very inflamed, and it's a pretty big area. Most people that have SI pain don't realize how big it is. They think that it's just where your dimples are in your low back, that's your SI joint. That's where we palpate it at the very top. Right here is where we're palpating those dimples. But the joint is actually quite long, and it's on both sides. Typically, this is a very, very stable joint, but it does move. And there are a lot of thick ligaments that are in this whole region, kind of back and forth to hold this joint really firm. So sacroiliac joint pain, that is another common cause of back pain. So let's talk about that a little bit. And so you see this gentleman, is kind of like, this is hurting me right in the back. And sometimes it wraps around from the back of you around that pelvis or that iliac crest to the front. So we typically see this with pain with sitting for long periods of time, pain localized to that sacroiliac joint. And they can usually get their finger right in it. And, or if I get my finger in it, I get them to jump a little bit. And it's pain local to that, and it can refer pain into the groin or the side of the leg. General causes could be arthritis in this joint. Weak ligaments or very tight ligaments can actually pull this off the rails. Trauma, especially a fall just directly to one side versus another, can be enough force to actually force that joint off. Car accidents can do that as well. And we often see, women in pregnancy develop SI problems. And why is that? Because they're going to be birthing that baby through that pelvis to begin with. So all of the hormones that come out with pregnancy, there's a hormone in particular called relaxin. And relaxin relaxes all the ligaments. So everything gets a little bit more loosey-goosey. And so what's happening there is there's too much instability. Now the woman is carrying, a 8 to 10 pound baby in the front. So the forces are changing. Her core may not be as strong as it needs to be. And so the low back loses its stability, and so does the SI joint. So we work with those women to try to reduce that. And even after they give birth, while the pain may get better, we like to see them afterwards as well, because they still might be off kilter and they've compensated throughout their, through locally, regionally, and maybe up and down the body, for 9 months. So sacroiliac is important. Someone asked me about, I'm not sure who that was now, who asked me, I think it was Karen, about how do we know if it's piriformis syndrome? So that's a really good question. So when somebody has a sacroiliac joint problem, the piriformis muscle actually is right here where the sacrum is, and it expands to the top of the hip. And it is a lateral hip muscle, and its job is to externally rotate the hip. And so interestingly enough, the sciatic nerve actually has to come down, and it a lot of times will either lie on top of the piriformis, or it'll go right through that piriformis muscle before it starts to get down the leg. So if something is off kilter in your back, your buttock, your your sacrum, sometimes that piriformis muscle goes into a little tight spasm, like the Charlie horse that the anonymous person said, would go from their left hip down to their leg. So that particular spasm can grab onto that sciatic nerve, and it can give you that sensation that goes down the leg. We know how to test for that. So we know how to put that sciatic nerve on tension, on relaxation. We know how to put your piriformis muscle and stretch it and strengthen it to see whether that's the trigger right there. But even if that is the trigger, the piriformis, unless you've had direct trauma to that piriformis, the piriformis is really reacting to something else that's not moving properly. So getting back to that might be the symptom, and it might, be part of the resolution, but we have to find out, is it reacting that way because the sacroiliac joint's offline and it's not really in the right place, or is it reacting because there's something happening above in the back that it's not happy with, and it's going into a little bit of a guarding. So that's our job to figure that out, but we know exactly what to do to figure that out. So let's talk about, what does successful treatment at Hayes Physical Therapy look like? So number one, we do a lot of manual therapy, hands-on physical therapy, hands on the body, right? And what does that mean? So there are several different manual therapy techniques that we're skilled for. We might be doing a soft tissue piece to sort of clear some of the muscles to make you be able to move a little bit easier. We might be doing a joint mobilization to mobilize the joint, and we're also trained into doing a little bit more manipulative work, which is really, really specific. It's not scary like what you might imagine some chiropractic offices might do, where it's a really big thrust. It's not like that. We're not standing on top of you and thrusting. We're doing a little gentle little mobilization and manipulation. And when we do that, when it's appropriate to do it, it relieves the muscle spasm right away. The muscle's just like, oh, thank you for that. And things start to fall back into place. We certainly mobilize the sacroiliac joint. Our examinations are so comprehensive that if you were to come in for a back screen, back evaluation, we'd be looking at your low back, your pelvis, which is your SI joint as well, and your hips, just to see if there's what's really at fault here and how many diagnoses are kind of working together. And I'll also tell you if there's a herniated disc involved, even if there are other things in play, hip mobility or sacroiliac, the herniated disc always takes top priority, because we want to reduce that so that that does not create more pain, weakness, numbness, tingling, or weakness in the leg. That's our biggest priority. And we also take in those other pieces in a safe way, but the top one comes from the herniated disc protecting that healing so it doesn't get worse. Manual therapy, we also do active release, also called ART, and myofascial release. So we do a lot of really great things for all diagnosis, but especially for the back. Now, we believe that as soon as we hit that reset button and get you back into alignment where you should be, we have to teach you immediately how to incorporate that back into your lifestyle and to retrain it immediately. So there's a reset button, and then there's a retraining button that has to happen. It's no good for you to come in and get us to manipulate something, then you run out the door. You know, we want to definitely integrate it so that it sticks and you get a new muscle memory versus going back into the old postural position that got you in the door to begin with. So exercise is really a key piece, especially stabilization. And the last thing we have that's really, really unique to our practice is our Class 4 laser. And if you go onto our website, which I'm going to provide to you a little bit later down, I'd encourage you to take a peek at it because it's pretty amazing what laser therapy has brought into our practice. And there's an amazing testimonial, video testimonial from a gentleman who, my gosh, we tried everything with, and you know, he was in tremendous amount of pain, and the laser saved his life. So Class 4 laser, we have 2 of them in the practice. It's very different than superficial Class 3 lasers. So some of you may be familiar. You might have had a laser treatment, a cold laser treatment in a chiropractor's office, or maybe a physical therapy practice. That is not the same. So that is not deep enough. That tissue only penetrates, that light beam only penetrates maybe about a ½ inch into the body. So you guys that are on this call here with back pain and sciatica, we got to get all the way through those thick back muscles, all the way down to the joint and all the way down to the nerve and the disc. And Class 4 laser is the only modality that can get down that deep in a healing way and create a healing response. So how does it work? It works through a process called photobiomodulation. Photobiomodulation. So if you guys have taken a break, you might want to take a couple notes on this because really, really cool to check it out. So photo is light energy. So that light energy is penetrating deep into the tissue. And it's a therapeutic wavelength. It is not the wavelength that surgeons use to cut or burn, cauterize, or ablation. It's not that. It's a different wavelength. So the light energy is received on a cellular level by the mitochondria of the cell, right? So mitochondria grab that light energy and convert it into new energy. The energy is then used to produce healthy collagen. So imagine you have a herniated disc, right? And that annular wall of the disc you've torn open and material has kind of seeped out on the nerve. That's the herniation. Exercise helps to shut that down to prevent any more material from coming out on that nerve root. But before the laser, we would say, oh my gosh, you know, it's going to take 12 weeks doing the right types of exercise for that disc wall to heal. If you're doing the wrong type of exercise and you're bringing your knees up to your chest and you're doing all these things as your friends and neighbors recommend it, you keep tearing open and more material keeps coming out. It's like tearing a scab off of an area that's trying to heal. So the body typically will heal and try to plug that hole over 12 weeks with scar tissue. Our Class 4 laser, because it actually changes the cellular biology, can actually help to put in new collagen in that area instead of scar tissue. So that's a really important piece, and we help people a lot quicker now. It also stimulates the immune system response. So the immune system, when there's inflammation and then when there's scar tissue that's starting to lay down rapidly, the immune system, the little leukocytes are like little Pac-Man. It comes in and it breaks down that debris and moves it out. So it kind of gives us a nice clean playing field. And then it also stimulates your local stem cells. So it's amazing. It's been something that was used in the veterinary world for years and years and years, and still is. And then it was introduced and approved by the FDA back in 2004. And so we just started to use it actually a year ago and have had amazing success with probably 85% of all the patients that need the laser, really great success. So we use it on herniated disc. We use it on bone-on-bone arthritis, including stenosis. We use it on neuropathies. Because all of these things need new collagen. You know, collagen covers everything. It covers your muscles, tendons, organs, nerve endings, bone. So all of that new stimulation is really, really important. And also it activates your own stem cells. So we use it for tendinopathies, tendon injuries, bone, nerve, all kinds of stuff, but especially herniated disc. So really, really amazing. So that's what successful treatment looks like in Hayes Physical Therapy. So what to do next? And then we're going to get to questions and answers. What to do next? If you're having pain right now, right? We're offering this to you right in this moment. You know, you've jumped on this particular webinar, you've jumped on this workshop because you're having pain and you want it to stop. The best way for you to take advantage is for you to contact our office. You can contact either by one of my coworkers is putting this in the chat button right now. That is you can go right here to schedule a complimentary screen. Doesn't cost you anything. You can also, let me go back here. Our website is here. And, oh, let me get back there. Sorry about that. Let me get to the end of this. So there we go. Our phone number is here. There we go. There we go. Sorry about that. Phone numbers here, our website, and a scheduler that you can go to. If you do hit this scheduler, the very next thing that you'll come to is this particular piece here that'll say, enter your information and we're here to help you. You just put in your first name, your email, your phone number, and then someone from our office will contact you immediately. So really, really a great step. So what are you going to get if you're having a complimentary screen? So the very first thing that you're going to receive if you get a complimentary screen is you're going to come in and you're going to work with one of my physical therapists. And they're gonna get a little bit of history from you, and they're gonna get to the root cause of what is causing you to have this pain, and what's the best way to resolve it. So they're gonna quickly screen out your back, your hips, and your pelvis, and they may give you an exercise or two, but for sure, we're gonna tell you what is the next best right step for you. And is it something that we'd want to actually set up a full evaluation? That's possible. Let me go back here and let me just get you to this piece here. There we go. So is it something that, we can help you with? We'll be able to tell you that right away. Yes, this is absolutely in our wheelhouse. We feel really confident. Why don't we try this? It may be something that, can prevent you from having to get injections or surgery, or if you've had injections or surgery, we can work at that as well. So if you're in pain, the next right step for you should be to contact our office. And if you're not comfortable during this time, of the pandemic, we can also do a complimentary screen virtually, so you do not have to come in. But the very first important thing is, let's talk about it. Let's see what's the right step for you. You don't want to ignore it. You don't want to alter it. You really want to take care of it once and for all so you can get back to the things that you really love to do. So really, really important. So I'm going to leave this page up here, and then I'm going to go to some specific questions. And if you don't have back pain, then just know we're here to help you in, anything else that comes up for you down the road. So let's go and see if we can see what's happening with you guys with some questions here. All right. Okay, so I want to go to the top of the list here. And so, Jen, you said that you get sciatic pain going down your left leg. Okay, so it's mostly recovered, but still really tight, and it's a little flared up after strenuous activity like golf or landscaping. Okay, so Jen, really important thing. that tightness, sometimes people mistake that for just like a tight hamstring, when it's actually the sciatic nerve, because it's embedded into the hamstring. It could be the nerve that's tight. So if the nerve is tight, maybe you just need a couple nerve glides that we can show you that'll free that up. But it might also be sort of implying that something else might be going on. So I would suggest, nothing to lose, Jen. We would love to see you come in for a complimentary screen, or let's do it virtually. And also Bob Henderson and myself, for any of you that are golfers, we also are Titleist Performance Institute medical professionals, which means that there's like a 16 top tier tests that we can actually take you through to let you know whether, how is your body meeting the mobility requirements for golf and the stability requirements for golf. And then also, of course, we would go into your landscaping activities to make sure you have good body mechanics. But I would be a little suspect of that sciatic nerve. I'm still feeling a little tight and maybe a little bit irritable. And I'd like to know for you, what is actually the cause of that? What's the root cause of that? And what can you do for exercise? So Jen, give us our office a call for a complimentary screen. And let's clean up those last little pieces for you. All right, Karen. Karen, you say that your pain is worse if you stand or walk too long. So that, Karen, can be more of an arthritis thing. You might fall into that category where when you're doing those activities, your spine is going into a little bit of extension. It could also be, Karen, that it's not that you can't do those activities, but you might need a little gentle mobilization to those, to the spine and to the ligaments around that, and maybe even through your hip and a couple other things as well, just to make sure that you're moving as best as you can, because a lot of times we can actually free that up and create better mobility for you. So then those activities become, something that you can continue to do, because let's face it, it's really, really good for your bone density and, for your psyche to be able to do those activities, especially walking for exercise is really, really great. So let's find out what's causing that sticking point for you. So yes, absolutely, talk to our therapist, and let's get on for a complimentary screen. The next person here, I'm just going to put, I'm answering some of these questions as we go. And if you guys have any follow-up questions, put them in the question and answers if I didn't quite get to the question exactly as you want it. So now going down to the person here, anonymous, who has pain on either side of your back from a fall a little bit ago. And also being a stomach sleeper doesn't help. Okay, so when you sleep on your belly, you actually put your spine in extension and sometimes even a little bit into hyperextension, which puts a lot of pressure on your facet joints. If the facet joints aren't carrying the weight evenly on both sides, that can be a source of pain. And we see that right away when we do our evaluations. We're able to assess, are they carrying the weight evenly, or is one side doing all the work and maybe that side's getting compressed and it's not happy because it's doing too much work, right? And it's not balanced out. So that's something that's easy for us to check out. And then also, from a fall, if you fell directly onto your back, I'd like to know, did you also knock your SI joint or your pelvis off a little bit? And so sometimes a little local problem becomes a regional compensation or even a total body piece. So please feel free to take us up on the complimentary screen. You guys have nothing to lose by doing that but the pain, right? So it's really a great offering. Shira, I see that you sit too long at your desk, and there's a couple other patients that said that, or clients that say that here too. Dushant also has the same thing, because you're sitting, you do IT. So in sitting, we work with patients a lot of time. We'll meet you where these problems are. So we're going to show you how to actually rock the pelvis for when you are sitting for long periods of time. Obviously, getting up and walking around is really helpful, but what if you can't do that? What if you're in a meeting for a couple hours? So we can give you some really good tips to actually create a little bit of gentle movement that actually can help your disc stay in a good alignment, because the longer you sit, especially if you're not sitting with good support, then you can start to go into a slumping, and you can start to silently put pressure on the disc wall. And, then you could have a cough or sneeze, and it could become something worse. So, you guys, Shira and Deshaun, I would encourage you to pop in for that complimentary screen, even if it's for, ergonomically, what's the best way for me to set up my desk station so that I actually have less pain? So really, really important. And, as you say here, Deshaun too, the pain is on and off, but you feel really good with walking. You feel really good with walking because it actually starts to push the disc material back in the center instead of, allowing it to go into a slump. So walking is great for you, but I think you should also get some really good tips from us as far as things you can do in sitting as well, because that's a killer, the prolonged sitting. So take advantage, give us a shout out. Someone else has mid-back pain and then a perceived heaviness and numbness in both feet. So that's interesting, right? So the middle back, the thoracic spine, there's 12 vertebrae. And one of the things that we also look at is, is your thoracic spine moving the way that it needs to be, which is side bending and rotation. If it's stuck and it's not moving, it's going to want to destabilize the segment below, which is your low back and your sacroiliac joint. Okay. So, there's a repeating pattern that's really interesting. Every other joint of the body either has more of a stability role or more of a motion or mobility. So when we start at the ground up, we look at, what's going on with your feet. Are they real flat-footed and real high arch? But your feet are actually supposed to be a stable environment. Then your ankle joints are more for motion, mobility. Your knees, stability. Your hips, mobility. So when we do our evaluation, because we're so comprehensive, if those hips aren't moving the way they should, and there's 6 planes of movement, then it can be robbing stability at the next segment because it's a repeating pattern. Hips, motion, mobility, low back and SI joint stability. And then the thoracic spine, which is your mid-back, is also mobility. So if your thoracic spine and your hips are tight, not moving well, it's going to rob that poor little back and your core stability. So we do look at all of that. So encourage you again to to contact us and get on for an in-person complimentary screen. It's only 20-30 minutes, so it's not a big chunk of time out of your day, and then you'll know and we'll know if we can help you, which we feel pretty confident about that as well. Again, I addressed earlier the person here who has the terrible pain in the left hip that shot down the leg. Charlie horse, that sounds nerve to me. And pain at night when you lie down, it's still hurting. You absolutely need to call us because I don't want that condition to go and masking it with just the pain medicine. We want to find out what's causing your nerve to give you such a bite. The body's a beautiful thing, and it will tell you exactly, it'll slow you down when you need to be slowed down, and it'll tell you exactly what you need to know. You just have to be trained to find out what's the right tissue here, so that we can help you. The person who had the core surgery, again, I'm assuming that, Bert, that was maybe an abdominoplasty that helped, and core stability is so important for golf. Absolutely. And a herniation. I just treated a guy yesterday from South Carolina virtually for a back evaluation. He's a very big golfer. And he was given the exercise sheet from his doctor, which included flexion exercises and extension exercises. And he has a disc problem. So, you can't do both. You have to find out the exact right exercises because while he was doing some things that made it better, he was doing other things that counterbalanced that. So one visit, I got him out of a tremendous amount of pain. And again, we also have specialties with golf, so we know what we're doing with that. So Bob Henderson or myself can certainly help you out with that, Bert, and we'd love to. And let's see here. Karen, I already answered that. How do you know if it's piriformis syndrome or not? We know that it's the piriformis by testing the piriformis, but that doesn't tell us why the issue is there. Why is that piriformis grabbing that sciatic nerve? That's what we need to find out. Okay, Bert, I see you. Thank you. Surgery was with Dr. Myers. I got it. Yep, I totally see that. That's probably for, yep, it's probably more hernia related potentially there. Yes, yes, I got it. I see what you're talking about there. And it's been a game changer for you. Yep. And, Bert, stay tuned because, give our office a shout out because we're actually going to be offering different golf classes virtually and in person, as a group format and then individually for golfers to continue to work with you guys. Plus, we have a K-Vest for body swing analysis, and both Bob and I are Titleist Performance Institute, people. So, yeah, definitely. I know Dr. Myers, Bert. Love to hear from you. Jen, no, nobody covers laser therapy. And the reason they don't cover laser therapy, well, I could only make a guess. It's not covered in the animal world. It's not covered in the human world. We've kept it really, really reasonably priced, and so that most of our patients can afford it. And so give our office a shout out about that, Jen, and we can have you come in for a complimentary screen. We could do a complimentary laser if we think that that's the answer for you. And then from there, we have it really reasonably priced. For example, if somebody comes in for a 30-minute appointment with laser, we're doing a $60 fee. When I first got the laser, it was recommended that we do like $150 for, a 20-minute treatment. I said I wasn't going to do that. I wanted everybody who needed it to be able to get it. In acute conditions, you may only need 6 visits on the laser. With something that's more chronic, you might need 10 to 12, but the best thing is to come on in, Jen. Let's take a look, see what we're dealing with, because maybe you don't even need the laser. Maybe you just need some hands-on pieces and that's all. But I'll tell you that the laser, all the professional sports teams have them, and all the high-end universities, they have them because their athletes get better 50% faster. So, and I've seen that too, because like Malvern Prep has their own, class 4 laser, which is right around the corner. I've seen it with athletes. We had a young athlete who she was a basketball player, and she had a spine fracture, and we were able to do it over acute fractures. And she did quite well. And she's going to scholarship next year up at Columbia. So really, really nice. And, but you may not need it. So come on in, let's find out if you do or not. So Bert, I want you to come in because I want to check and see where you are in order to give you those exercises, because everybody's a little bit different and I want to make sure you don't have anything else going on, and I want to see if you do them well. So yeah, I don't want to give you exercises, generically, but come in and Bob and I will give you the top 3 exercises if we feel like nothing else is going on for you that would jeopardize, or see how well you're doing them. Because that's, I'm a stickler for detail, so we want to check that out, but love to see you. And great that you're walking. Great that you're walking. That's excellent. Cool. Jen, I don't know what a third gun is. It sounds a little scary, Jen. I'm not sure what that is, but we're very holistic in our approach as well, Jen. Our physical therapy practice, we do the myofascial pieces, we do some craniosacral, we also have an integrated healing center on the 2nd floor of our building, and I have a husband and wife osteopathic team. We have functional medicine there. We do yoga, we do energy healing, massage therapy, acupuncture. I have an amazing acupuncturist who's there on Wednesdays. So we have the best of both worlds, your traditional and your complementary services as well. And believe in that wholeheartedly. I actually have a 4-year training program in energy healing as well with Barbara Brennan approach. So yeah, and it's a percussion gun. That's probably sounds like maybe what the chiropractors use for tight muscles, better than foam rolling. Well, again, interesting, right? When we look at why is something tight, Yeah, it might be tight because you're working out really hard, right? But it also might be tight because A, something's just a little bit off in the joint. And as soon as we put that back into place, that spasm goes and it goes down. So again, treating the symptom is not what we do. We get right to that cause and see what's the best way to make that a permanent fix for you. And then Barb, last but not least, yep, upper left back and sciatica, pain with walking or sitting too long. So I know, Barb, it's probably a big core stability issue, and it's postural endurance in different positions. So that's where we have to meet you with that. So walking and sitting, teaching you how to hold that core and giving you some fun activities. So I'm going to say, I believe I answered everybody's questions and answers that seem to be here. But again, what I'm going to say is, listen, don't ignore it any further, right? Don't alter the way you do it. Once we see somebody in physical therapy and we get them feeling better, right before we get ready to discharge them, we'll also say this to them. We're going to do a head-to-toe functional movement assessment on you, which is going to point out very quickly if there's anything else we might have missed that is directly or indirectly related to this. Do you want to do that? And like 100% of the time people say, yes, oh my God, that's so unique. Nobody's ever done that, or, so on and so forth. So we really like to make sure that, we've given you all the tools to feel better, to heal from this, and to start moving properly. So I want to thank you all for your great attendance today. Really great questions. I hope that was helpful, but it was kind of a general format today. Take advantage, nothing to lose but the pain, to get in there for a complimentary screen. We are happy to help. And if you're not comfortable coming into the office, just to let you know, we're following all the CDC guidelines. We have 2 floors of our building so that everybody is one-on-one. They're wearing, mask, glove. We're taking body temperatures. We're really on it. And, we want to keep everybody safe. And if you don't feel comfortable, coming in, set up a virtual screen, because we got this. This is our wheelhouse, and happy to help. So I'm going to sign off for now. It's a beautiful day. I hope everybody has a great rest of the day. And if you need us, 610-695-9913. Also, just check out our website for fun, because we have a lot of great stories on there, and including all the stuff on the laser. So check that out. And I'm going to sign off for now. So have a good day, everybody.